Welcome to the final part of my patient empowerment series. If you remember, we've already covered patient self-awareness, self-advocacy, and in this video, I'm talking about system awareness. System awareness is about how you can better understand the healthcare system that you are in, be able to navigate through different barriers, and get the care that you deserve. Depending on where you live, healthcare systems may vary, but there are some common points that can help you in most clinical spaces. Even if you're from a lower income community where healthcare, resources are lacking compared to higher income neighborhoods, or you come from a community where there's a lot of distrust for healthcare providers, the information that I have to share can still help you. As a patient, you can still take steps to advocate for yourself and understand how to navigate the healthcare environment so that you get better care. Now, of course, healthcare providers should always uphold the highest standards of professionalism, integrity, and be patient-centered. However, that doesn't always happen. So even when it's not at its best, how do you navigate the system to get the care that you deserve? Start by being aware of the space where you are seeking care. Look around and get a sense of how the staff behave with you and with each other. Are there posters on the wall or welcoming messages that make you feel like it's an inclusive space, a respectful space? That's the first thing, because if it is, well, then you're good. If it's not, then you might have to navigate a little bit differently. The truth is, no healthcare space is perfect, but some will be a better fit for you than others. Now, some of you might be fortunate enough to have a primary care provider or specialist that checks all of your boxes. But that's not always the case for everyone, and that's okay. The question is, how do you empower yourself to make sure that you're getting the type of care that you need? The core message that I have is know your rights as a patient and the different avenues and pathways that you have to express your concerns. Know that you have the power to be an active participant in your care. If you feel mistreated, you do have options. If it happens in a hospital or in a larger healthcare setting, there are usually pathways for addressing your complaints. For instance, in the province of Ontario, hospitals have an ombudsperson. That's a person or office that you can go to file your complaint, and it will be investigated. Lots of hospitals have a patient advocate role, so a professional who will help you in navigating the system or ensuring that you feel heard. And in pretty much every region, if it really gets to that point, then going to the licensing body for the healthcare professional or the physician to file a complaint is often an option as well. The bottom line is that if you are in a healthcare space that is not emotionally respectful, then you have the right to voice your concerns. And sometimes it can be very egregious, but that's actually pretty rare. Sometimes the mistreatment isn't obvious. In fact, oftentimes it's very subtle in the form of microaggressions, biased assumptions, and subtle ways of being dismissed. No matter how the mistreatment happens, it shouldn't happen because your health is supposed to be the priority. If you're unsure about your experience, remember what we discussed in the last video. Bringing a family member or a trusted person with you can make all the difference. Having a second set of ears and eyes to observe what is going on can help you in identifying if there was any mistreatment and addressing it. By practicing system awareness, which involves knowing your rights and also knowing how to file a complaint when something goes wrong, it increases the potential that you will have better health care outcomes, but also can make the systems better and safer for others. You do have the power to be able to change your own healthcare system. If you've made it through this last video of the series, thank you. You've already taken a huge step towards reclaiming your voice. Whether you're overcoming medical anxiety, seeking safer clinical spaces, or you're learning to speak up for yourself in a clinical environment, remember that this journey is not about perfection. It's about progress, reflection, and empowerment so that you can get better care. You deserve to be seen, you deserve to be heard, and you deserve care that honors your full and whole self. And remember, you got this.